According to the CDC, every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall.
Falling can not only be devastating to your physical well-being, but traumatic to your day-to-day life. Have a look.
Unfortunately, as we get older, the risk of falling increases. There are studies that show that over age 65, 1 out of every 4 people over age 65 has an increased risk of falling and actually falls. And of those people who fall, they have twice the chance of falling again. So once that first fall occurs, it can be very detrimental to someone's health and well-being. There becomes a fear of falling. You're not necessarily living your life to its fullest because of that fear of falling. But there's ways to be able to prevent that first fall and certainly have discussions with your provider to hopefully minimize that chance. Reviewing things like medications which may cause drowsiness, adjusting dose schedule or having medicines taken at night sometimes is important. Reviewing things like over-the-counter supplements, making sure that there's not a concern regarding alcohol use that may contribute. Helping to improve things like strength and balance, doing regular physical activity to help with strength and training. All these things can be helpful to lessen and prevent falls. Making sure that you're keeping your vision and hearing up to date, because certainly that can contribute to limiting your falls. In the home environment, having a reduced amount of clutter in the home, minimizing things that can cause slipping, like throw rugs, making sure that you're wearing rubber-soled shoes in the home to give you better balance and support, minimizing the use of things like socks that may cause you more slippage, taking your time when you go from a sitting position to standing and possibly holding on to something if you need, utilizing things like an assistive device if it's needed, cane or a walker. One of the standard recommendations that we have is increased physical activity, 30 minutes of walking 5 days a week. That sounds very basic, though it's difficult to obtain that kind of a goal, but even something as simple as walking, that movement can really help improve your strength and stability. So I have a senior female patient who was having concerns regarding osteoporosis and frail bones. She decided to really change her life around and become more physically active and started doing some basic exercises and activities. She got so enthusiastic with activities. She's actually the exercise director for her nursing home. So she's doing these balance and training activities, and she's in her 80s, and she's helping her friends and her residents there do balance and chair exercises and yoga and deep breathing exercises. And that's a great story of someone who really took it to heart and helped their friends and their fellow residents to help improve in their own strength and balance. And what we are trying to do in Intermountain at the My Generation clinics is really screen patients on a regular basis so that we are asking those questions. If you've fallen within the past 3 months, what were the conditions that led up to your fall? And when we can identify that there is someone who feels imbalanced and may have a risk of a fall, or someone that has already fallen, we really are aggressive as far as getting the support on board to help prevent another fall, as far as getting physical therapy on board and offering other services that can help prevent that fall. So once a fall has occurred, there's a twice greater likelihood of falling to occur again. And what unfortunately can happen is that people will become more fearful of falling. They'll have that apprehension that they could fall, and that could certainly limit them from living out their full life and not doing things that they would normally have done because of that fear of falling. So it's really important that we are in touch with our healthcare provider to be able to share that with them so we can make sure that we're helping you live your healthiest lives possible.